My name is Jay and welcome to RX Therapy. Today, I would like to introduce you Check and Correct program. A lot of my patients ask me the same questions over and over again. Why I have a loose mobility in one area or I have a pain in another. This is video for you and for people who would like to stay healthy, perform better, live pain-free. So what's the check program is? This is the first part, and it's a group of tests and specific exercise to find out if any problem with the joints, so we lose mobility or we lose stability, and also muscles, which muscles get tight or which muscles get inhibit, weak. Because most mistake, people sometimes stretch inhibit muscle and activate the tight muscle or mobilize joints, which is supposed to be stable, not immobile. We go over this during the session, but now let's find out why it's happened to us. When we're born and go through the childhood, we probably move the same. Everyone move the same till we get specific job or school, because we use the pattern hours and hours. We use the same movements, same sitting, same position. Let's say example, I'm a worker at the computer desk. I'm sitting every day. Probably I'm going to sit for a couple hours straight, try to control my postural, but after 2 hours, I'm going to get tired. My muscles get tired, so I'm leaned forward and I'm sitting up here. And I don't control this movement, but I'm almost there. I mean, always there. And what happened to me? One group of muscles gets super tight, like a PAX. Another group of muscle, which is antagonist in the back, get it weak. And most people feel that discomfort in the back because muscle get inhibited and send you the message, we need something to do about it. We need to activate us, help us. But what we do, we basically start stretching. This is not right. We have to activate those muscles. And also we lose those mobility in our thoracic area. So what we need to do, we need to create this mobility, because if we lose mobility in one area, we can lose stability. Let's say if we lose mobility in our thoracic area, we start to turn around, which we're supposed to be control our movements to look around. We start using lower back, but lower back, it's a stable area. That's why this Check and Correct is going to help you to understand better your body, better your postural and pattern you can change. Mobility is achieved by coordination, action, and surrounding tissue as a neuromuscular system. As you can see on this picture, we're going to start from the foot. It's easy to remember because the first thing first, your foot have to be stable. We have to be grounded and control our standing on the ground. The next one, it's an ankle. We have to move in all different directions. That's why the ankle have to be mobile. The next one, it's a knee, and knee also have to be stable. The next one, it's a hip. The hip is moving in all different direction and dimension, like a transfer and sagittal plan. So have to be. The next one, it's a lumbar area. This is our core and have to be stable. If we're moving up, we'll see the thoracic area have to be mobile because we look around, we turn around. The next, it's a shoulder. Shoulder also have to be mobile. And the cervical area and scapula have to be stable. Also elbow have to be stable. Wrist have to be mobile. So it's easy to remember. We start with a stable and mobile and stable and mobile and go all the way up. It's a big mistake when people try to mobilize stable joints. Let's say my thoracic area have to be mobile. My lumbar area have to be stable. I feel discomfort because I lose in my lower body because I lose mobility in my thoracic area. And I'm start doing those movements and twist it around to take a look around. I use more lower back, but my lower back have to be stable. So I need to mobilize my thoracic area to help my lumbar area. Mobility always trump stability. So fix mobility first and you might help with your stability. what's the motor control problem or stability problem? The simple to understand is, if I can reach, let's say my shoulder have to be 90 degrees in external rotation, and I can reach it, let's say I can reach to 10 degrees, but if I'm apply a little bit pressure and I easily can go to this 90 degrees, that's mean my brain is not allowing me to reach this 90 degrees, but someone or some force from the side can help me with that. That's mean I've been injured a long time ago somewhere, or using the everyday pattern during those years, build my completely different pattern. So it's changed my movements. My brain is not allowing me to send the impulse which is supposed to be. So we've finally been talking about mobility, stability, and motor control problem, and we know what kind of pain and what's the cause of the pain or patterns. So now it's time to apply those tests to your body. This program have a simple 4 rules. The rule number 1, it's no pain. If you do feel pain during those tests or exercise, stop and contact your professional near you. The second rule, it's no shoes and level surface. So take your shoes off and step on a level surface. Rule number 3, it's no warm up. Please don't stretch and don't warm up your body before doing those tests, because it's going to be effective of our tests. The number 4, it's better to do with somebody else. So grab the observer, your friend, your gym buddy, and make sure you're doing right together. It's always better to do together, because you can see if you compensate, one part of the body to another. Let's say lower body to upper body, or joints to other joints. So enjoy this program. I hope you're going to find this beneficial, and you will a little bit understand which muscle you have to be mobile, which muscle have to be stable, and what kind of what kind of angles supposed to be at your body. So you know the numbers now. Enjoy this program. First test, it's a lumbar spinal test. You have to stay against the wall 6 inches away. Attach your glutes and thoracic and neck. Now you try to slide your arm under your lumbar area. If you slide just the fingers and your wrist, you have a normal lumbar curve. If you can slide greater than that, you probably have anterior tilt or lordosis. If you can slide anything, your back might be flat. This was the first test. Next test, it's a neck flexion, a cervical radial motion flexion. What we have to do, we have stay straight, close your teeth, and bend hand forward. Try to touch your chin to the chest. If you have a space, that means you have a limited neck flexion and you have a cervical radial motion problem. As you can see, I'm bent a little bit to the right. That's probably my occipital joints is a little bit stuck. So I need to work on that and improve this in the future. So if you have a bigger space, you have a head forward postural. The next test is a thoracic spine rotation and mobility. We have to sit down tall, chest up. You need to place pillow, bolster, or any ball between your legs and squeeze with a light pressure. Cross your arms and put PVC pipe for the measure your angle. Now you try to rotate it without any shifting weights to the side, to the left, and to the right. You have to reach 55 degrees for full radial motion of your thoracic area. Sit down straight and evenly keep your weight on the hips. Do not shift the weight. Next test is going to be pec minor muscle. It's a muscle on your chest. What we're looking for, we lay down flat. We can use a table or a floor. We're looking for the acromial process right in the back. It's a bony part, and the distance between this acromial process and the surface, and it have to be 1 inch or less. As you can see, we already see it. It's a more than 1 inch, but the Michael's gonna measure by himself. This is how you have to do it. So you just bring across the arm, across the shoulder, and measure this distance. Yeah, away, and it have to be 1 inch or less. In this case, Michael have a tight pectoralis minor muscle. That was your pectoralis minor muscle test. Next test, it's a pectoralis major test. Also chest muscle. We have to lay down on the surface floor. We use massage table. Palms up. We have to try to reach 90 degrees without shifting shoulders and arching back. If you're not able to reach 90 degrees without shifting your shoulders, you fail the test and you're probably short on your pec muscle. Next test is a shoulder flexion. We're gonna lay down on a firm surface, face up. The thumbs is up, and we'll try to raise arm overhead 180 degrees. The main idea is not arch the back and reach this 180 degrees. If you can reach the 180 degrees, you got a shoulder flexion problem, or you have a mobility in the shoulder problem. How does it feel, Michael?
It's good.
Good. Make sure it's not shifted and arched back. The next test is going to be internal and external rotation of the shoulder. In this test, we're going to check mobility of the shoulder. Go ahead, Michael, and do external rotation and apply this hand. Make sure you not shifted your shoulder, and go ahead and try to reach the surface. We're looking for 90 degrees and without shifting the shoulder right in here. So as I can see, he reached the 90 degrees, perfect. And we're gonna do a drop inside. We're looking for 60 degrees in this case. And I believe he's a little bit short up there, yes. Let me try to help you out, yes. So definitely we have a internal rotation shoulder problem. Next test, it's a leg raise or hip flexion test. Lay down flat and try to keep neutral spine of your lower back. Try to slide your fingers under the lower back. And if you slide it more than your fingers, you're not keeping neutral. Try to be flat. Next, you're gonna raise your leg up straight. Don't try to bend your knee. If you bend your knee, you might have a tight hamstring and weak hip flexors. Keep straight. Don't compensate with other leg. As you can see, I bend my knee. Don't try to do that. And as you can see, I'm also raised my other leg up. Try to keep this maintained and go slow. Focus more on the range of motion. If you can't able to reach 70 degrees, that's mean you have a weak hip flexors. Okay. So the next test, it's a Faber test. What we test, it's a hip range of motion and growing muscle. We're gonna ask Michael to place this leg on the opposite knee, above the knee, and drop this down. What we're looking for is a parallel and without shifting any hip. As you can see, a little bit shifted. Or if you want to measure, it have to be two wrists, two fists. And as you can see, he's pretty good on this side. And let's go ahead and do other side. So growing muscle and hip range of motion. And drop it down. And actually, you see, this one is greater. So we have a more range of motion in this hip and a little bit limited in this one. But he passed the test. That was your favorite test. Next test, it's a hip and knee flexion seated. You have to sit tall, place your arms on the hips, bend your legs 90 degrees. We looking for 120 degrees to reach of elevation your knee. Don't bend your back. Sit chest up. Don't bend to the side. Do this correctly. If you feel tension and pain, stop doing this exercise. Focus on 120 degrees. Do not shift your lower back. The next test is going to be the rock back test. and also show us relationship between your lumbar area, thoracic, and cervical spine. So we're gonna ask Michael go to quadrupedal position. It's a position with when your shoulder reach the wrist, so basically doggy style. And we're gonna place the stick right on the back, and we're gonna make sure it's attached with the tailbone, the mid area, and head. And as you can see, it's not touching the thoracic area, so something going on between the cervical spine and thoracic area. But otherwise, have to be 3 points attached: tailbone, thoracic, and head. That was your test on relationship between cervical and thoracic and lumbar spine. Okay, next test, it's a face down knee flexion. In this test, we try to figure out what's a relationship between anterior leg and hip. We're gonna lay down straight. In this case, we're gonna use massage table. You can lay down on the table, and we're gonna bend knee without tilting pelvis and changing spine curve. We're gonna bring to 120 degrees. Go ahead, Michael, and do with the right side. As you can see, he almost reached 120 degrees without change the pelvis, tilting pelvis and change the spine. That's really good. Let's try the other side. And I believe he's perfectly reached 120 degrees. That was your face down knee flexion test. Next test is a Thomas test. Sit straight 3-4 inches on the edge of the massage table or bench. Go ahead and lay down back on the table. Bring your both knee to your torso. Make sure you're not bending towards your knees. Now we're going to test the relationship between PSOS, your quadriceps muscles, and hip flexors. Now we're going to slowly drop one leg down and see how do you feel. If you feel your leg going to the side, you have a hip flexors problem and tight PSOS. If you're not bending your knee to 90 degrees, that's mean your quadriceps muscle is really tight. So Thomas test, it's show relationship between quadriceps, PSOS, and IT band muscle. Repeat other side. Let's take a look from the side. So sit on the edge of the table. Now I'm going to lay down on the table, straight down, and make sure I'm not bend my spine. I got to bring both knees to 120 degrees and slowly going to drop one leg at a time. As you can see, my relationship between my shin muscle and my quadriceps is not 90 degrees between, that angle. So that's meaning my quadriceps is tight. If I get close to the knee, I have a posterior muscle problem, posterior kinetic line. Also, if I bring my knee to the side, as you can see on the first video, that's mean my hip flexors is tight. Do it right. The next test, it's an abduction and adduction of the hip. That's mean we're going to move our extremity away from the body and towards the body. You're going to lay down straight with your leg straight and move your leg away from the body. We try to reach 45 degrees. If you're short, you fail this test. After, you're going to adduct the other hip. The normal adduction of the hip from 10 to 30 degrees. If you can reach 10 or 30 degrees, you have an adduction hip problem. Lay down straight, don't rotate your leg, and don't bend your knee. Do it right. So the next test, it's a hip internal rotation. Sit tall, bend your knee 90 degrees. Internal rotation hip by moving foot outward. Try to reach 35 degrees. If you're shorter than 35, we have an internal rotation problem. Keep your weight even on both hips. Do not shift your weight, bend your spine, or raise your leg up. So as you can see, the mic a little bit short on internal rotation. And let's try the mic do other side. And as you can see, a little bit short on this one too. Okay. The next test, it's a hip external rotation. Sit tall, bend your knee 90 degrees. External rotation hip by moving foot inward. Try to reach 45 degrees. Keep the weight even on the both hip. Do not shift your weight, bend your spine, or raise your leg up. As you can see, Michael, a little bit short. It's not 45 degrees. And let's try the left leg. Do the same thing. Do not raise your leg up. Try to drop it down. It's a little bit better, but still limited. That was hip external rotation. Okay, and the next test, it's a single leg stand. If you would like to be astronaut, this is definitely test for you. So simple test, we're gonna ask Michael to raise the left leg up and stay for 10 seconds and see if he's not shifting any weights and try to compensate. This is definitely failed the test and you need something to work on. I can see it's pretty good, a little shaky right there, 10 seconds. Okay, yeah, it's shifted definitely. And let's try to do right leg now. Here we go, 10 seconds. Yeah, if you start to see the shifting, you can do against the wall or with the gym partner. Here we go, that's what we see. He just failed this test. Next test, it's an ankle mobility through the dorsiflexions. Stay away 3-4 inches away from the wall. Bring your knee to the midline of your big toe and try to touch the wall. If you're not able to touch the wall, you have an ankle mobility problem. Do not lift your heel up. The heel have to be on the floor all the time. The idea of the test, touch the wall with your knee. The next test, we're going to test the glutes muscle, and this is called single leg bridge. We're going to ask Michael to lay down on the floor and go and do bridge, the straight line. Make sure you not overdo it and not just a straight line right now, like you see on the camera. And we're going to ask him to raise leg up. Make sure he's not going to shift it and drop alignment. If you do that, so the glutes muscle is weak. And go ahead and put it down and try to do left one. And I can see, yes, I can see he's a little bit shifted right there. So he failed this test. Have to be a little bit, activate your glutes to pass this test. That was your gluteus muscle test.